We've got a daughter, Emmy. She's 16 and diagnosed whenever she was 4 back in 2012. At the time, we were living in Atlanta, Georgia, and Dr. Stevens she was under the care of Dr. Stevens. At the time of her diagnosis, she was presented with fever, rash, arthritis in her ankles, knees, wrists, and elbows. Fortunately, Dr. Stevens started a really aggressive treatment with her. We on to biologics really within a month of her diagnosis. And we really couldn't find the right, combination for Emmy. She was on steroids from the get-go, was on steroids for the first 6.5 years, and we cycled through many, many biologics from Kineret to Actemra, Humira, Xeljanz, Ilaris, and she had her first bout with MAS in 2017. And at that point in time, the plan of care became Orencia and Ilaris because Emmy had many systemic flares throughout her and continues to have them throughout her journey, but she also has a lot of arthritis in her joints as well. So once we got on the treatment of Orencia and Ilaris, we were gradually able to wean her off steroids after being on them for 6.5 years. And we just managed her joint pain with pulses and joint injections in hopes of keeping her off of oral steroids since she was it was very challenging to get her off of them. In this time period, though, Emmy was diagnosed also with AMPS and psoriasis. The psoriasis became more present after she came off of the steroids because that had been managing that. In late 2021, we transferred our care to Cincy once we moved back home. And that was the first time that Emmy had her IL-18 and her CXCL9 tested as early as, I guess, whenever we moved back, her IL-18 was in the upper 10,000s, and as it continues to climb, as recently as she had MAS in July of 24, it is, at the last time we tested it, was 167,000, as you can see, and then her CXCL9 also continues to climb, with MAS and the systemic flares that she has. Since moving back from to Indiana, Emmy's also developed Hashimoto's disease and other GI issues such as EOE and a chronic pyloric ulcer, which we have been able to get that ulcer under control, but it has developed a left scar tissue there that she deals with complications from that on an ongoing basis. Orencia and Ilaris have stopped working for her, and since then she's had numerous systemic flares that's required hospitalization, and some have come along with more bouts of MAS. Her most recent bout with MAS was in July of 24, and it had attacked her liver at that time. And she started back in July of 23 becoming steroid dependent again because she had a bad systemic flare that landed her in the hospital in July of 23, then again in December 23, March of 24, and then back July of 24. So her systemic and her arthritis issues keep growing. Since July of 23, she's back to being steroid dependent. She is still on the combination of Ilaris and Orencia. We have tried going back to Xeljanz. We've tried Jakafi, and we're back to Orencia. And then she's on oral steroids, and we're also supplementing with pulse steroids. So today, basically where we're at, we've been waiting for her to get on MS-825. We first had those conversations or learned of that back in July of 23, and then as she progressed since then, we really started moving in the spring of 24, trying to get her on that medication. We're hopeful that next month she will get on that. In the meantime, we have consulted with BMT team at Cincy, and they are open to a BMT. However, they do want to have her try MS-825 before all of that. So, but as I'm sitting here trying to, pack 12 years of a journey into a very short amount of time and feeling like I've got my 16-year-old daughter sitting here on my shoulder, wanting to make sure I am advocating for her as much as I can and not minimizing her journey. If it was up to her, she's processed a lot. Has a very strong voice and, on her journey, and a BMT is where her heart and her head is. She became very hopeful after meeting with that team, and her concern is with MS 825. She's been on this journey long enough to know that these drugs are only going to last her for a certain period of time if they work at all. And so her mind is what's going to happen after, if MAS 825 works for her, how long is it going to work? And once it stops working, where do we go from there?